Welcome. Thank you so much for joining us today. My name is Dr. Louise Ivers, and I am the director of the Harvard Global Health Institute and professor of medicine and professor of global health and social medicine at Harvard Medical School. I'm delighted to welcome you to HDHI's Coffee Sessions. This is our virtual series that brings together voices from across the global health landscape, working to advance global health equity. Today's coffee sessions is going to be a very exciting one. We turn our focus to the rapid deployment of AI, drawing insights from Rwanda, a country at the center of high-profile partnerships with OpenAI, the Gates Foundation, and Anthropic, to examine a fundamental question: how to ensure that these collaborations deliver public value, strengthen local sovereignty, rather than prioritizing only corporate goals or creating harm. We're going to have time at the end of the presentations and discussion to answer audience questions. So if you have a question, please submit it through the Q&A feature and we'll do our best to get to those. The session is being recorded through Zoom, and we're going to make the recording available on the HDHI website and YouTube page in the coming days. So with that, please allow me to introduce our speakers today and welcome them to the forum. Ms. Esther Kunda is the Director General for Innovation and Emerging Technologies at the Ministry of Information, Communication Technology and Innovation of Rwanda, where she drives policy initiatives and interventions to support the Rwandan innovation ecosystem and development of new emerging technologies in the country. She recently spearheaded key initiatives such as the National AI Policy and the FinTech Strategy, among others. She is also a counselor representing Rwanda in the International Telecommunication Union Council. Before joining the Ministry of ICT and Innovation, Esther Kunda was the Policy, Innovation, and Community of Scientists Manager at the Next Einstein Forum. Welcome. Dr. Chinasa T. Okolo is the founder of Technecultura, a policy specialist at the United Nations Office for Digital and Emerging Technologies, and holds a computer science Ph.D. from Cornell University. Her research focuses on AI governance and safety for the global majority, datification and algorithmic marginalization, and the geopolitical impacts of AI. Dr. Okolo has been recognized as one of the world's most influential people in AI by Time, honored in the inaugural Forbes 30 Under 30 AI list, and advises numerous multilateral institutions, national governments, corporations, and nonprofits. She's a former fellow at the Brookings Institution and has worked in research-based roles at Apple and Microsoft. So it's an absolute honor to have you both with us today. I can't imagine two more amazing women to be here speaking with me about this really important topic, and I'm going to dive right in. I'm going to start with you, Dr. Okolo. You have written a lot and quite recently about the rapid pace of AI partnership announcements across the globe and especially the global south, noting especially, and I'll quote this, how valuable African markets have become to tech companies. Can you share a bit about your work and how our audience should understand this and the motivations that are driving the partnerships, both from the government's point of view and the corporate lenses?
Session. And I would say that, Africa has been a market for tech companies for a long time. But when it comes to AI, we've seen this, recent boom in interest. And I would say there are a couple of different things driving this. One, we do have an indigenous technology ecosystem that has honestly aimed to fill in the gap, from where technology companies were not effectively serving beforehand. And we've also seen, our technology ecosystem, particularly within East Africa, innovate in the mobile money services, and it actually has set a model for the rest of the world. And so as we come back to AI, as these indigenous and grassroots efforts arise, or have arisen, excuse me, to focus on developing these natural language processing solutions and other AI solutions for the continent. We see these companies have built AI research labs, or centers, et cetera, or development hubs, and then also are expanding, let's say, their services, whether it be ChatGPT, or Claude or Gemini as well. And so a lot of this interest obviously is because, Africa has a very young population who are digitally savvy. And so they will be a large consumer base for these companies. I would say not necessarily a strong consumer base because of the respective spending power that they hold compared to other countries. And this is also one reason why it is taking so long, for these companies to come to Africa because of, the economic viability of running or, leveraging AI services across the continent, excuse me, which can be and is right now at the moment still very expensive, given high, data cost and just generally, sparse connectivity, particularly around the Central Africa, and even, across the Sahel as well. And so this interest is rising and will continue to rise. And I'll let Esther speak about the government side of things as well.
Great, thank you. Let me also ask you, Esther, as we come into this, that Rwanda has, for at least 2 decades, really put itself in the position of being a leader in this space. Initially, really talking about the digital transformation, and now, the AI transformation, and recently positioned itself as Africa's AI lab and responsible AI champion through the national AI policy, which you were really a big part of, as well as recently announcing these new partnerships with leading companies that I mentioned in the opening. Can you talk us through a little bit in following from Chinasa's comments about the decision-making process around these partnerships and what the opportunities they present are, and how you and the country of Rwanda is thinking about concerns and how to manage those?
Thank you very much, Louise, and thank you for inviting me for this interesting conversation. I think, as you mentioned, Rwanda, we've positioned technology and use of technology over more than now like 2 decades as part of our cross-cutting. We'll use technology as a cross-cutting tool to fuel other sectors. And we've managed to really support that in how government does service delivery, in how we were able to transform quickly our health sector and get better healthcare services to people, thinking about different sectors and how they deliver their own services, whether it's in agriculture, in procurement, in reducing corruption and other sectors. And with AI, this is not a different approach in how we're thinking about it. So in a couple of years back, when we've been thinking about, so why Rwanda and why do we position ourselves like this? First, where we're a landlocked country, very small, market-wise on the continent. I think most companies would not even consider Rwanda as a market. Even today, I think it's a fact that you have to deal with. So for us, how we think about this is it means that every technology deployment that happens, any benefit would come to you late, or any adverse effect will also affect you in a way that you can't reverse it and you can't even address it. So for us, what we've now positioned ourselves is to think of Rwanda as a proof of concept hub, but also start small and scale in a way that we can understand. And that's why when we think about technology, we're willing to work together at the regulatory level and policy level with technology providers to really understand and go deep in understanding what does this mean for a Rwandan citizen? How does this look like? And in terms of governance, what do we need to develop? So even with AI, that's how we're approaching this. So we're saying there's a black box on the effect of AI on Rwandan citizens, and especially on the continent level. We still have the biggest gap in terms of number of people who are connected, who are online. So when we close the connectivity issue and people come online, they will come in a world where AI is is really ruling most of the technology that they use. So how do we address that effect? What does deployment delivery look like? What governance model do we need to do? And that's what we're doing. So today, when we approach this partnership, we look into one in making sure that we're trying to understand what the technologies are doing, and in parallel, developing the right governance model and structures that are required to do that. But on the other side, we make sure that we root the solutions and the use cases that we deploy in things that are relevant to the Rwandan citizen. And that's where the focus around health, agriculture, education also come from, because then you have to balance that social impact, and as well as developing the governance model as fast as you can. Thank you.
Thank you. Dr. Okolo, can you speak a little bit to your research and your experience about some of the concerns? Some of the AI companies lobby against meaningful regulations. I know in some of your briefing work that I've read from the Brookings Institution, you go through some of the potential concerns, and one of the big issues related to equity, and at the Global Health Institute, we think about this a lot, is how unequally harms can be applied. Would you share a little bit with us and your audience how you think about this? And, we can come back to specifically the healthcare sector too.
Yeah, definitely. Yeah, so as someone, raised in the United States, I have, seen up close how lobbying has impacted, legislation in very key domains. And this is something that, has occurred obviously over decades now. But when it comes to like digital policy specifically, it's honestly, I would say the core reason why the US does not have federal data privacy legislation and also federal AI legislation, despite we've seen some movement in the past week or so from the Trump administration to develop this national AI policy framework. But again, it's not binding legislation as well. And just generally, companies have an interest in ensuring that they can have as much as a free market as possible so they can innovate without guidelines or boundaries in many cases. And we've seen the detrimental impacts of this phase of development or ideal development. And when it comes to the global majority, because countries across these regions, also particularly within Africa, don't have a lot of this capacity in-house to develop and pass AI-specific legislation, this lobbying will actually have a bit of, let's say, a more detrimental impact. And we've seen this already happen in Brazil, where lobbying from tech companies actually weakened provisions, of their respective AI law. And expect this to occur across other regions again, because, tech companies bring a lot of money. They make a lot of statements around, investing in, the country's economies, also providing free resources like digital training and upskilling as well, which has been positive. In understanding the long-term impacts of that respective work is still, I would say, up in the air to me, because we still see, workers in these regions not necessarily engaging in meaningful work when it comes to AI, which is something I'll probably get into later. But again, because they have this kind of like these tech companies, excuse me, have power, over governments in a way, and it also looks attractive to governments to announce these high, visibility partnerships with tech companies. There is a little bit of imbalance, and we've also seen already across Africa, like tech companies and other organizations being involved in AI policy and strategy development, particularly in the case of Nigeria, which was a strategy document that I actually directly helped on as well. So I'm very wary, but I think governments also need to understand what works best for them more broadly.
And can I stay with you? Thank you. Can I stay with you a little for a moment and just see if you have any special concerns as it relates to the healthcare sector specifically, or how we might want to be watching around corporate interests
Mhm.
there?
Yeah. Yeah, and so we've seen that right now. A lot of there's this idea that these tech companies, particularly AI focused frontier companies, are running out of data. But honestly, the data that they're running out of is essentially what's already on the internet, and then also what has been captured from the Western users who are active users of these digital platforms who provide data on a daily basis. And so when it comes to African countries, when it comes to those in South and Southeast Asia, Latin America, there is a lot of, let's say, like undigitized data. I did my dissertation research on community healthcare workers in rural India. And when I was in these clinics during my field work, like I saw like basically stacks of papers high, in these clinics. And I assume I've been to clinics, across Africa as well. And I know it's the same thing. And so there's a lot of, resources that are, or knowledge that has still been unlocked. Not only obviously, within Western richer countries, but, again, across these global majority countries that AI companies are I was honestly like, keen to have. And so their expansion into these regions also provides them with another valuable aspect for AI training, which is data.
Yeah, thank you. Ms. Kunda, I'm going to turn to you back to you again. Rwanda's national AI policy is very comprehensive and has numerous six priority areas that I'd love you to share a little bit with the audience about if they're not familiar. Um, One of the things I'd like to talk to you about too is the trustworthiness question, that the trustworthiness in AI for the public sector. But I also
Mhm.
think that many of the things that Dr. Okolo just mentioned related to sovereignty and kind of being in charge of the issue is what was on the agenda for the government of Rwanda as an observer. And I'd love to hear how that AI policy helps set the stage and the framework for those types of engagements with AI companies and perhaps other governments could also learn or other organizations could learn from that.
Mm. Thank you. I think for us, when we were developing the AI policy, was actually almost at the same time as we were also finishing the data protection and privacy law. So they all like emerged almost at the same time. And when we were thinking about what does AI look like, for us, the number one objective was really to say that there's a technology that is not typical to how other technology have transformed or even impacted different economies. So thinking about labor impact, going into different other sectors, accruing inequalities, and as well as eroding.
Oh, we seem to have lost her. Okay, I'm sure she will be right back. Why don't we pause on that question and oh, you're right back.
Yeah,
We
can you
lost,
hear me?
yeah, we can hear you. We lost you for just about 10 seconds. So please
All
keep
right.
go ahead.
Sorry about that. Yeah,
No
so I was
problem.
saying is like both our policy, both the law and the policy came at the same time. And really our focus was on a couple of things. So thinking about skilling and AI literacy for everyone. And when in skilling, it's really understanding how do you reskill and upskilling your population to adapt to the new changes. The second one was around data, and I think Dr. Okolo just talked about what that looks like, and really doing the background work around where is the data, how do we define data sovereignty for us, and how do we also define data protection for our citizen and implement the law as it's supposed to be implemented. The other one was on compute. I think that's a pretty clear answer. And then also understanding what adoption, how do we drive adoption, both from the public sector, really trying to put forward how would government in itself adopt AI, but also how would citizen, what does impact on citizen look like? On trust, what we started putting in place was to see AI has to really be, we have to adopt this in a responsible and ethical way. I think transparency is very important, trust is very important, and especially as government moves to be a digital government, it's very important that we keep the trust. we keep the trust of our citizen in terms of the systems and technology that we use. And we think from the government point of view, if we adopt responsibly, then that also will help us in putting in place the right governing tools for the private sector and the rest of the ecosystem. So I think that's how we were looking at it, and then today how we continue to work around it is we have our data protection office that really highly look at it, but some of the sectors that are highly regulated, like the financial sector, health sector, and the telecommunication sector, the regulators are currently building either sandboxes to test what the impact of these technologies, but also moving ahead to now putting in place guidelines and processes that any AI developer would or a solution would have to go through to get to the citizen, if I should say so. So it's all in a building process. But for us, the policy was now like an initial way to say we need to be responsible and continue to make sure that we are not our citizens trust the services and the impact some of these solutions are bringing.
Thank you. I want to maybe prod a little bit on the concept of transparency in the AI
Mhm.
space. You know, I think it can be a challenge. I'm thinking that it's a challenge because we looks like Esther has some challenges with her Wi-Fi, so we'll hold for her to come back. But I can pose this one to you, Dr. Okolo, because you have a PhD in computer science. So the building blocks of AI and the details, like you're in there, you get that. I think as it advances at a rapid pace, the general public everywhere, it's a little bit less clear what's behind the curtain of what's happening. So how do we, generally speaking, in speaking about transparency for AI, how do we make sure that the general public actually understands across the board, because it requires, I think, a certain degree of trust in the decision makers to be making the best kinds of decisions for the public. But can you speak to how you think about transparency in this realm?
Yeah, great question. And so I would say for me, from my dissertation research actually looked at, explainability, particularly in terms of how we can make this kind of methodology accessible to global South or, users in low resource context. And this is really important because basically, like even a lot of like the model developers themselves don't necessarily understand how AI, systems or models make and produce decisions. And so explainability is kind of, let's say, in some ways like a band-aid solution because you're analyzing the outputs after they have actually run. And so there's also another field within computer science or AI focused on interpretability. And so really trying to ingrain, excuse me, like this and explainability like throughout the model itself, so we can actually kind of like break through this black box to really have a better or more comprehensive view of how does data impact model outputs, how does the actual like structure of the neural networks or the architecture in the model itself impact decisions, which is something that a lot of people don't understand at the moment. And then also again, like how do just like very minor tweaks, when you're fine tuning or adapting these models, also play a role in impacting decisions as well. And so this is more so like a technical thing that has to happen, which companies like Anthropic are really focused on at the moment, and others as well, obviously. And then on a policy side of things and, engaging civil society and also the general public, I would say government has a responsibility, to, let's say, advocate for these explainability, interpretability approaches, but also really, do the work themselves to have this in-house capability to audit, to evaluate these models to ensure that developers are providing solutions that work in the way that they say they can. Honestly, at this moment, AI tools or models are still very, let's say, like unpredictable in a way. So this is also like an issue that is, still a challenge, but the civil society also can play a role in developing the solutions to ensure that models and everything like that can be, or just AI itself can be explained and also develop these like literacy resources as well.
Thank you. Esther, I'd like to ask you a bit about the health sector. So the way I think of AI is, building on the digital transformation that was a little bit how we talked about things maybe a year ago or 2 years ago, even, at least in my world. And in Rwanda, you mentioned how numerous digital technologies have been embraced and piloted to improve health system and health outcomes and healthcare delivery. Could you speak a little bit to that area that is a little bit of the background work that I think would both give consumers and end users and citizens trust in the next steps of the digital use in terms of AI? Does that question make sense? Building from using it in a day-to-day way that actually impacts. You could imagine the next step of AI as opposed to going from nothing to AI. Can you share with us how
Mm.
Rwanda has embraced digital technologies in the health sector?
Thank you. I think so. A couple of things that we've tried to implement. So, for example, we have community health workers that work within villages and communities to support, especially on primary health care, and on maternal mortality. And for the longest time, they've had, for example, SMS applications where they're able to report back, but also have access to the information that they need, to the structured guideline, let me call it like that they use in the field every single day. So recently also we've been working on making sure that all hospitals have an interoperable EMR. We've also looked at other structures like beyond the main hospitals, the health centers, with at the health post level, which is like a very small community health clinic, let me call it like that, that provides the basics of healthcare. Bring in digitization tools that enable to really give access to information to the health post, but also even for the patient be able to record some of the record that inter patient and nurse interaction, and be able to also recognize them that either they have health insurance and all that. So digitizing the health infrastructure in itself, and enabling the health professionals to also have technology in their hands, has helped us in now having information that is structured. And actually, one of the interesting things is that a couple of years back, when we were looking at maternal mortality, we got to a point where we were stuck on one statistics because of using surveys to get to that data. So with that interconnectivity now, we have more live information around maternal mortality, child mortality, and the Ministry of Health has been able now to start deploying dedicated interventions to address specific issues there. So now, as we think about AI, we're building on that digital infrastructure to understand where's the information, what data is required, but also how do you have robust systems where you're able to protect the patient, make sure that you have consent on use of their data, and also start also looking at what are the important use cases that can be developed along that. And that's how recently we also created the National Health Intelligence Center to be able to start looking at really closely monitoring maternal mortality, looking at where investments in bringing healthcare to the people should go, and then also looking at something like managing ambulances in the country, etc. So I think it's very ambitious items, and we're building on those use cases now to think about, for example, a good thing, we don't have many radiologists. So something like a support tool across the country for anywhere you have the right equipments, so that all the few radiologists that we do have can support as many health centers as possible. And then we also launched an e-Ubuzima app, which is an app that helps now consultation and support across the country in terms of bringing healthcare to everyone, and can also support telemedicine if necessary. So that infrastructure is very important. And now what we are looking at is, for example, when we think about AI, is like what kind of support tools can we bring into the hands of whether it's community health workers, nurses, and other health professionals, to help them in the decision tree of healthcare. So between exams that and as well as any type of process that they use in triage. It has also we've also started thinking about some of these use cases, and we are looking at others that might be supply chain of medicine is also another area that we're now looking at how effectively we can distribute medicine across the country. So I think these are some of the use cases now we see that we can tackle immediately.
Thank you. Dr. Okolo, back to you. I'm going to ask, I've heard you use the term technosolutionism, and I don't know if that's your term but that's the first time I'd heard that term, and I loved it because as a doctor myself over the years, I've felt like there's often technology or ideas that people think are going to suddenly solve the fundamental infrastructure issues, human resources issues, and supply issues for providing healthcare. So I'm optimistic about the future, and I like to believe that technology will help us really advance issues. Yet I have some concerns about the way that large language models have been especially trained on a small amount of data from the minority, not from the global majority. And then the language has been largely English. And that has resulted already in, I think, some information that through other languages, misinformation or disinformation can be worse. Could you speak a little bit to that? Again, remaining optimistic, I am at least, and I believe you are about the possibilities, some of the concerns that we all should really be paying attention to. We don't hear you.
Oh, really? Okay.
Perfect. Thank you.
Yes, so I was saying that technosolutionism is not my word, but it was a word that was super helpful in the framing of the work that I did on that piece I wrote for Brookings last year, and just generally because there's this idea that AI can essentially solve all of humanity's problems, and this kind of has this framing comes from those within communities that are focused on investing for social good and trying to maximize human life as much as possible. And this is should be a good thing for the most part, but I'm honestly like, sometimes it diverts attention away when we're thinking about AI as a solution, from investing in the basics. And so, it's very hard to deploy these, AI systems in hospitals if you actually don't have hospitals in the first place. And so my work and my advocacy more broadly is really, ensuring that we are not losing our sight of it's again solving these basic socioeconomic development issues, while honestly trying to understand where AI can help be a complement and not a replacement to this respective work. And so for me, I would say I just really caution governments to examine these respective partnerships to understand, again, how they can both benefit the government itself, but also generally the citizens, the communities that the government is here to serve, and is, collects taxes for as well. And so this is something I would say, again, I'm very passionate about and adamant about because it's a need, it's necessary. We can't, there's a lot of progress that's still left to be made. And AI will not, again, be the arbiter or final decision maker when it comes to this as well.
Great, thank you. I'm going to start involving now the questions from the audience. So thanks, audience members from all over the world. Keep those questions coming in. And the first set of questions I'm turning to you, Ms. Kunda. So because you mentioned AI use in radiology and how that was an innovation that had been deployed, and we have a few questions that are related to that. One is whether you can explain a little more about it, are you having fully AI reading of radiology, or is there a human in the loop in that scenario? And then also a question about, congratulating Rwanda on progress in digital health and addressing inequity, and asking if you have tools that have been put into place that are specifically looking at rural health facilities and how AI might be able to help to resolve some of the challenges that we all face in rural healthcare.
Mm. So a quick and I'll also segue into what even add to what Dr. Okolo was talking about. One, I think when we think about deployment of AI solutions, one, for example, one of the key goal of the Ministry of Health is to have a health facility within less than 30 minutes of walking from every Rwandan citizen. So what that means that despite thinking about any type of technology, that infrastructure has to be there because that's one of the goal. Think about health professionals, even as we go ahead with technology. Today, one of our goal is to quadruple the number of health professionals in Rwanda in the next, so it's like a 4-year program, and we're now in the midway of quadrupling health professionals. So what that means is that one, health facilities and infrastructure is very, very important. You cannot technology your way out of the lack of infrastructure. They cannot even happen. And then health professionals are also very important. One of the conversation that we always have with the Minister of Health is around who is accountable for the medical decision that is made. At the end of the day, whether you have technology with you or not, the health professional is the accountable party on anything and the outcome that comes out of this. So what we are trying to do is not to remove the human into the process, because again, that accountability is retained there. But in this case, for example, a couple of years back, we only had about 9 radiologists in the country. And you can imagine what does care look like at scale when you have so few radiologists. They are overworked, and they also cannot serve the entire country because they cannot be in all facilities at the same time. So what technology helps them do is, and just to also be frank, some of these solutions we're also using an approach, and let me bring it. I'll talk about it in a few minutes. But so what the technology is bringing is supporting this health professional with information and support. It's a support tool into the work that they're doing, but it does not remove the accountability and the decision that they're having to do. And the way, for example, now, in terms of the approach that we are using, for most use cases, LLMs and some of the solutions, they'll come when you start looking at them, there's a promise of this is going to solve everything. And this is so untrue. Because one, you've not tested on the data set, and we know, like, I think globally, less than 2% of data sets from Africa have been part of the training data of all these models that we see. So it's a problem that we know. So for us, we've made decision that we need to test for that. We also need to make sure that this solution, especially if they're citizen facing, they have to be in our local language. And those are deliberate investments that we are going to build on as we continue to see where this work. Specifically for health, how we approach solution implementation, we always start with what we call a silent trial. So we don't go immediately and say, oh, we've seen this fantastic technology or solution. Now let's do a countrywide deployment. So we do a silent trial. We test if Kinyarwanda is working. We test if the insights are working, or whatever the goal of the solution looks like is working. And then we move into clinical trials, which is what our FDA now is really doing in terms of determining what does AI solutions, what does the clinical trial of those process look like? And then we down the line, we will look at what full-scale deployment is going to be. But that process has to be there, and you also have to make investment choices, which are around language, being more towards voice because that is what we're usually more voice oriented than anything else, and build towards that. So that means that even at the government level, there's so much that investment has to be done because private companies are not going to invest in that. We're starting to see investment in languages, but not that much that it will serve every use case that we are thinking about. So down the line and in parallel with the partnership we're doing, we have to make investment and make sure that that works as we start deploying.
Thank you. Chinasa, I want to turn to you a little bit about, and I'll come back to you, Esther, on this too, for what you're able to or willing to share with us. But how best for countries to structure their partnerships with AI companies. We saw Anthropic had walked back some of their safeguarding plans earlier this year. Do you have recommendations, Dr. Okolo, that you give to countries or in your work with the multilateral agencies that can help structure these? So there's a retention of sovereignty
Yeah.
and also like embracing the innovation and the opportunity of the partnerships.
Yeah, definitely. And so I would say we've also seen a lot of, health partnerships that have been formed, with the United States actually. And there was a one with Kenya that required 25 years of data access. And then it was lowered down to 7. And then the partnership was like kind of, I would say I believe Kenya stepped back from the partnership. And so not sure if they're reevaluating it with intentions to finalize an agreement, but I know Senegal actually finalized agreement with the U.S. last week or the week before, and actually didn't mention anything about data access. But I'm still a little bit wary about that. And so when it comes to these partnerships more broadly, whether it be with another government like the U.S. or with a tech company, it's really important for African governments, particularly, to understand, a lot of these core, issues around data sharing and how, they can comply with their respective laws. In Africa, about 44 countries have data protection laws. And so it's imperative, that they abide by those laws, but also ensure that any company or entity that is aiming to work with them abides by that as well. Even though there are no binding AI laws within Africa, data protection still serves as a formal legal instrument at the moment. And then honestly, as well, understanding, when it comes to data usage and when it comes to the partnerships themselves, how long will the partnerships be? Again, what access does this give, companies, if they develop models, from data that is used or, let's say is not used, is there, some kind of agreement when it comes to IP, profit sharing, what does that look like? And then again, what capacity, does the partnership actually bring to the government? Will it be, outside contractors, from the company, or that the company hires separately, or will Africans, in the respective countries, actually get opportunities, to increase their livelihoods and also their skills as well, to ensure that they have a solid stake, in this partnership too. So those are some of the things I think about.
Great, thank you. And Ms. Kunda, in so much as you can share with us, there's a lot of interest from our audience about how MOU was negotiated with Anthropic. But even if it's not possible to get into the specifics, although please share as much as you're able, can you use that opportunity of the question to tell us about some of the critical or reinforce, because I think you've mentioned this over our time of talking, some of the critical policy issues that Rwanda wanted to ensure were kind of hard in the relationship.
Mhm. Thank you. I think when we were negotiating any of these partnership, and for example, specifically with Anthropic, we're looking at one, understanding the technology. What does it do? What's I'll call it like the black box behind it, because even down the line, generally, even if it's not with a partnership with government, it's going to be used in the country. But also most of the times we root this in use cases that we can define, and we can really go down into understanding risks behind them, and understand what the impact would be if this was a successful deployment down the line. So these are some of the things that we are always looking at when we are negotiating different partnerships. The other one, we also make sure that we have a pathway to have local capacity, both within government, but also even in the private, in local private sector, so that some of those capabilities are retained in the market, and we don't have to have. I think a couple of years back, all of us on the continent were still talking about vendor lock-in to different systems. And it's still something that is very, very on top of our mind on how we approach some of these things. But also, key thing that we embed in most of the partnership is understand that along any of the development, we are going to be developing regulations for that. So those partnership also help us in building parallel regulation that apply to any of those partnerships. So, for example, for partners like Anthropic, the discussions have been understanding the models, understanding where it makes sense to develop use cases. And it's not a blanket of saying tomorrow everything is going to be using Claude in every system. So it is use case specific and outcome and we define very clearly the outcomes that we want to see. And in terms of like when you scale this beyond one company, again, we always think about, can we start small and have the room for experimentation? And sometimes personally, I don't like parachuting a technology and thinking that you're going to take it as is without any customization to the local context and working towards understanding what does a good outcome look like. So I think and that's how we've approached most of the partnerships that we continue to work on.
Thank you so much. We have a number of questions that are on the topic of clinical data, patient data, healthcare related data, and data is such a big part of it's a product now that companies and agencies and governments want, some governments want. I noticed, in the bilateral arrangements that the Trump administration is now putting in place with relationship to international development with many countries, they're putting data as part of the trade, minerals, data, international aid, and it can be a concern. Can you speak a little bit more to that, Dr. Okolo? You mentioned earlier on about, we talked about Africa as being a large place for technology and AI, but having relatively lower spending power. How do we ensure that populations, maybe not in Rwanda as much, I don't know, but in other places where they're going to enter the digital space straight into this AI scenario. How do we protect personal information and private information?
Yeah, definitely. I mean, so on the technical side, there exists, many different privacy preserving methodologies that can be embedded and are actively embedded within AI systems. And so this should obviously be a priority, alongside, again, governments ensuring that these AI systems align, with existing regulation. And then I think just generally, there has to be an ideal or framing around reimagining with like what mainstream AI development looks like in the first place. Right now, like the goal is, bigger and better and faster. And in many cases, to actually just like develop AI that can be useful for the average user, you don't need such a huge model. And when it comes to African users themselves, we know that most Africans access digital technologies through mobile phones. Many of may, which not even actually be smartphones. And so scaling down this development to meet, African consumers and those in other regions, where they are, actually will provide better benefits where people can leverage AI in ways that are meaningful for them, and also contextually relevant because it actually works in their language, is not taking up a lot of their data, that is also exorbitantly priced compared to other regions across the world, and then also, again, provides them with the information they need to be an informed consumer and adopter of AI, which I think should be the end goal for AI usage more broadly.
Great, thank you. I'd love to ask both of you about this. We've mentioned a couple of the very big AI companies, the big technology companies. Is there still space for innovation that's indigenous? You mentioned, part of colonialism is the notion that Africa, consumes knowledge from elsewhere, which is totally false. And in this space, you mentioned early on, the innovation on mobile money and a lot of grassroots efforts, early digital adoption, and the concept should be highlighted of great innovation, ideas, technologies emerging from the continent. In the AI space, is there still opportunity there? How do we hold that space for smaller companies, smaller organizations, innovators to get in there when we're mostly talking about a few big tech companies?
I could go ahead and answer that. I think for me, there's such a big space. A good example, for example, when we think about language, on the continent, we've been talking about languages for a very, very long time. So one of our companies took the bet early, even like in 2018-19, to start collecting Kinyarwanda data sets and putting them out there. And then at some point, I think after English, we were almost like the third, with more voice data in available online in terms of language. And now they've developed like models of how you get languages online for other African languages, etc. And even now, and as you're saying, there's the big models, but even as we've done like the scoping of use cases, where actually, for example, from the government point of view, AI would be useful. Um, the use cases actually do not even call for most of the big models to be used. The most impactful ways you would use AI, it's not always the big models that will make the biggest dent. So I think for us, really looking at so for example, now we're starting to think about different ways we can partner with startups that have ideas, how government can procure for innovation in different spaces, and as we scope use cases that we're interested in, how we use a local company to build these solutions. Because I think it also helps us in really going deep in either using the right data sets in and contextualizing and saying that we're actually serving the Rwandan citizen much better than relying on companies that are generally taking a global point of view and deciding based on different markets. So there's a room, and I think there's such a big opportunity for use cases on the continent. I think the biggest hurdle is getting good investment into the AI space.
Thanks. Would you like to come in on that too?
Yeah, definitely. Definitely agree with Esther. And I would say there should be an incentive for every government in Africa, and even again, those across global majority regions, to invest in their local ecosystems because, big tech should not be the only solution that you provide. And honestly, like, when it comes to the case of Africa, where we see big issues of un and underemployment, like, this is a very, very viable pathway for, young Africans and again, those across the age spectrum to actually meaningfully contribute to their economies and also increase their respective livelihoods. And so I'm very much in favor of local ecosystems being strengthened and supported by African governments. And again, not having this monopoly of big tech, which is not healthy, economically or just, more broadly as well.
Thanks. And can I stay with you just to ask you a little bit about, the training or education or skilling that might be needed or perhaps
Mhm.
already there? Or like what's your advice there, Dr. Okolo, to ensure that there's a sufficiently trained and knowledgeable scientific community too in that space?
Yeah, most definitely. As someone with a PhD, I'm very adamant that this model of actually trading and outputting PhDs and also master students, excuse me, has to also be a priority for African governments because right now, the main model across Africa is that students will either go to South Africa or let's say Morocco or Kenya to get their respective tertiary education. A lot of this is still concentrated in South Africa because they have the best universities, particularly on the continent, for higher level STEM training. If they don't go to one of these, if African students don't go to one of these three countries, then they go to the EU, UK, Canada, or the US. And when they go there, outside of the continent, even outside of their own country, there's actually less incentive for them to come back. And it's not just because of, let's say, obviously it's because of, like training and, being, let's say, getting actual value from the employment that they can seek in these other countries. But also, they still feel tied to home. And so, in the governments themselves, so they don't, provide this actual environment that can support good salaries and also, again, meaningful employment, then there's no incentive. And so governments have to focus on, creating jobs for a PhD and master's level trained students, but honestly, also providing the opportunities for students to get this education at home.
Thanks. And Ms. Kunda, that was upskilling and training is definitely part of the AI policy. And in many ways, I see as a lesson from Rwanda in all of this has been about putting time, energy, effort, and allocating resources within government to be sure that you're able to lead in this area. But can you speak a little bit to that question before we close out the session?
Yeah. So I think reskilling and upskilling and AI literacy, even like basic AI literacy, is very, very important. So, for example, for public service, over the last couple of months, we've done almost like AI literacy with basic courses online for about 130,000 public servants across. We've done dedicated session with our parliament and senate. And for us is to see, starting with even like awareness, understanding, and then later on when we go into sector specific understanding. So when we talked, for example, to our parliament, we're saying this is AI. Um, these are some of the risk, and you're doing legislation. Please, as the voice of citizen, you need to let us know from the technology point of view, what are the things that we should be developing and designing for. The last one is really looking and partnering with education, higher education institution like different. We have different on the con in Rwanda like Carnegie Mellon, Ames, and ALU. Now to really bring AI and the talent that we need on the continent to be trained and be the ones that either help us in development of the solutions or even become the entrepreneurs of tomorrow as we think about it. But skilling is and AI literacy is one of our top priorities in ensuring that all sectors we understand what we're doing in all those different sectors.
Great, thanks. We have 1 minute left, so I'm going to just give each of you 30 seconds to say anything that you wanted to say that we didn't get on, or any closing thoughts. I'll start with you, Dr. Okolo, and then we'll give you the final word, Ms. Kunda.
Yeah, so we covered a lot of stuff, in this conversation today, but I would say just generally that there's a lot of, benefits that I still believe that AI can bring is that we just have to be measured in our respective scale of development, but also, again, cautious in terms of, the promises and claims that, companies or even other entities, purport about the capabilities of their models. And so African governments be cautious, but also be optimistic and open.
Great.
Mm.
Ms. Kunda, you get the final word.
Thank you. I think for me, it's very important that we define where AI makes a difference, and where it would bring, for example, like economic and good social impact. But also, especially from the African point of view, we have to be willing to do the hard work of everything that we don't understand. I think we cannot put all our promises in very big company to say that they're going to make that investment. So we have to work very hard on skilling our people, making sure that we understand data sovereignty and everything around it, and developing the right ecosystem for ourselves.
Fabulous. Thank you both so much. This has been really wonderful. I've really enjoyed speaking with you. Thanks to our audience for joining us, and for your engagement and your questions. Before I go, mark your calendars for April 24th, our next session. We'll send more details soon. Thank you, everyone, so much. Really, I've learned a lot and really appreciate your time, Ms. Kunda and Dr. Okolo.
Thank you so
Thank
much
you
for the
very much.
invitation.
Thank you.
Bye.
Alrighty, take care.